Hi, Dr.
Sorry, my microphone was off.
And have a recorded and consistent passion for matters health, agriculture, science, and environment. It is a great pleasure to be here with you all, and welcome to this webinar of the Kenya Veterinary Association, Nairobi branch. Uh, Without further ado, it will be my pleasure now to introduce the panelists who will be making presentations. Remember, today our topic is the importance of, our main subject today is the importance of food systems in public health. And food systems can be very simply defined as the process of production of food all the way from the field to the plate of the consumer. So as we go through the presentations, as we listen to the presentations, I would like to encourage the participants to pay attention and also announce that there will be that space or that opportunity to ask questions later on. The presentations will be limited to 5 minutes per presenter. And then once the presentations are done, we will have a Q&A session. For the journalists that will be in attendance can also ask questions. Participants will also be allowed to ask questions. If you have a question to ask, you can raise your hand using the option at the bottom of the menu there, at the menu that is at the bottom of the screen. And we will be able to take up those questions and give you that opportunity to ask. As well as also, you can also send them as text messages and we will find a way to give you a response. Now, to the panelists that will be doing the presentations, we have Dr. Joyce Thaya, who is the current head of the VPH section in the DVS. She has worked in the VPH, Food and Feed Policy and Standards Development, Inspection and Certification, and has experience that is comprehensive in the livestock value chain development for the last 33 years. We also have Dr. Victor Yamo, who is a veterinary surgeon with over 25 years of working within production systems to improve the productivity of farm animals, leading to improved food security and livelihoods. Dr. Yamo is currently working as a Humane and Sustainable Agriculture Campaign Manager at the World Animal Protection Africa office. We also have Dr. John Mushibi, who is a veterinarian trained at the University of Nairobi and has over 30 years experience in the veterinary pharmaceutical industry within the broader East African region. And he's also a member of the Chartered Institute of Marketing. He has worked in different capacities for the regional veterinary pharmaceutical giants, including Unga Limited, Norbrook, and Coopers. Last but not least, we have Dr. Maurice Karani, who is a veterinary epidemiologist. Also,
Conrad, please.
Conrad, kindly mute your mic. Yes, as I was saying, Dr. Karani is a veterinary epidemiologist and a researcher at the International Livestock Research Institute. He is interested in the biology, epidemiology, and control of zoonotic disease with a focus on understanding the factors involved in the emergence, risk, transmission, persistence, spread, and disease burden of pathogens in both human and animal populations. He has 7 years experience researching on animal source value chains. A question has just come in that for this particular event for today, so I'll be getting back to you on that one. Thank you for the lady who just asked the question. So without further ado, I think this should be now time for our first presenter, our first panelist to make the presentation. Thank you. Dr. Joyce Dwyer should be first off the block with the presentation entitled, "What is the impact of COVID-19 on the livestock value chain?" What is the impact of COVID-19 on the livestock value chain? Dr. Joyce Dwyer, please.
Thank you,
the floor is yours now.
Good afternoon, everyone. I hope you can hear me. Can you hear me?
Yes, we can.
Oh, thank you, Sam. I've been asked to talk about the impact of COVID-19 on the livestock value chains. I want to look at it from 3 areas mainly. I want to look at it from the animal health point of view, also from a socio-economic point of view, and then other issues or other related areas of impact. On animal health, we want to appreciate with the issue of COVID-19, many countries, including Kenya, have reallocated resources in response to the COVID-19. So these, we have an impact on resources that would go to animal health because most of other sectors have been affected because of the reallocation of resources. Also, we are having problems in many countries and counties because of reduced surveillance activities, because of logistical issues. Some areas, some laboratories have been used for COVID-19 as opposed to the normal use in animal health. So that would reduce the work on animal health. Then there is also, because of the testing that is going on, there is in some areas the shortage of RNA extraction kits. the preliminaries, issues, swabs, and such, because these are being again reallocated to the area of the research and the testing for COVID, and this reduces the availability for animal health. PPEs in some countries have been diverted, so animal health being impacted by that, but also because of the restriction on movement, activities have been reduced. In Kenya, fortunately, there was allowance veterinary services were considered as essential services, so that improved. But still, because of the lack of public transport, many people are restricted. So the offering of the service was impacted on. If I go to the socio-economic impact, many activities, the lockdown, the travel restriction, the border control, resulted in difficult movement.
This way you're losing you. You could speak to the mic.
Sorry, I don't know why you're not seeing me. The mic and the video are on, unless somebody has muted me from the other end. So the difficulty in movement of the products to the market, this has impacted. In fact, in some places, the production has gone down quite a lot. In Kenya, in particular, some of the people who deal with the food business operators dealing with animal products have reduced their production because of the movement. Also, because of the closure of the hotel industry, the demand for the products has gone down. So that goes back to production and the income for the farmers. There has been restricted capacity of purchase of the necessary production inputs because of those restrictions. Labor and professional services have been impacted on, and also the closure of markets for livestock. The owners of the animals are not able to sell their animals and their produce, so this has impacted on their economy and on their resources. And so they are not able even to put the inputs into the production of the animals and care for the animals and also the animal health. The third one is the other issue. There's a possibility of transmitting the virus. This research has shown that there's a possibility of transmitting the virus between human and animals. This is creating a lot of anxiety as research goes on. And also the psychological impact. We know in all aspects, in all sectors, there has been a lot of psychological impact of the pandemic, leading to increase in mental health issues, including in the livestock value chain actors. And this has a likelihood on impacting on the productivity of the animals and productivity of the animal value chain actors, and also the care for the animals. I think questions or issues I will answer. So thank you.
Thank you, Dr. Adhaya, for that.
Over to you.
Thank you, Dr. Adhaya, for that very comprehensive presentation. But now, just for purposes of enlightening us and all the rest of the participants that are here, you have spoken about concerns raised on COVID being a zoonotic disease.
Yes.
Could you basically just highlight a little bit on what can be done, maybe to keep us safe from contracting some of these zoonotic diseases going forward as farmers and even as consumers of animal products? Very briefly.
Thank you for that question. Yes, there is a lot of concern with the cases having been identified in pets. Research is going on to actually say for sure, is this transmissible back to human beings from the animals? But like any other zoonotic diseases, the importance of, again, distancing, if that were possible, distancing, that just like we are doing in human beings, the physical distancing, the animals, particularly for the vulnerables, the children, the elderly, and people with the comorbidities or pre-existing conditions. It is important. It's also important to take care of the animals themselves. If animals are showing signs of sickness, let them be taken to the veterinarian who can be able to look at them and probably identify other conditions. As I say, research in COVID-19 is still going on. So your vet may not be able to tell you that the cat is having COVID-19, but it can be done like the other tests. But the most important thing is to take care of yourself, keep distances, keep clean the animals where the animals are, keep their environment clean, and feed them well, good nutrition to boost their immunity as well. Thank you. Agree.
Thank you so much, Dr. Thaya. Now, at this point, we will, I don't know whether we will I'll have to consult whether we'll have, people, I believe the questions that people wanted to ask, maybe we'll take them to the end of the session. When all the presentations have been made, then we will have the questions that maybe people would want to direct to you. Now, next on our list is our next presenter. I'd like to thank Dr. Thaya for being very time conscious. Our next presenter is Dr. Victor Yamo, and the presentation is entitled, "How can we rethink our relationship with nature through the lens of food?" How can we rethink our relationship with nature through the lens of food? Remember, today's subject once again was the importance of food systems in public health. So Dr. Yamo is going to be taking us through how we can rethink the relationship that we have with nature through the lens of food. Dr. Yamo, please.
Before, Agri, with your permission, before Victor takes over, there's a poll that would like just to, so that to set the rest of the meeting. The poll is just running shortly. It'll run for the next 2 minutes. And if people can just click based on what they think, and then we will take it on from there with Victor. So the poll is running now.
Thank you so much, Dr. Derek. As you have heard, participants and panelists and everyone else that is on board, the poll is right there on your screen. So kindly take the poll and submit the questions so that we can go on to the next presentation. Thank you.
Oliver, just mute, please. And Conrad as well.
Find out, come on.
Right.
Yeah.
Right, I'll end the poll just now. Okay, you'll see the results shortly.
Does this then give us the leeway to call the next presenter, the next panelist to present? All right. Having gone through the poll, whose results you're going to see shortly, we will then now clear the way for Dr. Victor Eyamo to make his presentation.
Thank you very much, Agri. Mine will be very brief because I think the idea is to just stimulate a discussion, then we can pick up the questions from there. The reason why I think over the last few months, there's been higher concentration and interest in the connection between food, especially of animal origin, and nature, for lack of a better term. Essentially because COVID-19 is purportedly said to have started from a wet market somewhere in Wuhan, China. And it said that it also originated from bats, then went through a series of other animals. And I think I will leave that to the scientists to continue looking at. My interest would be then, how then do we manage this process? And how do we then start working around food systems to ensure that food systems are not impacting negatively on the environment, which then has an impact on the public health, the health of the general public, or public health as it were. To start us off, maybe what we might need to also consider is, what is the relationship between nature, food, and health? And I think we, as we progress as a continent, we are slowly beginning to see the criticalness of having a one health approach to some of these things, or a one welfare approach now that I'm from the one welfare end of it, where we then look at the connection between the environment, the animals that you're trying to put in that environment, or the animals in the environment, and then humanity, or the population, and the interaction between those and the impact on health around those things. And so it's very critical, and I think we are beginning to recognize certain facts. I find it very interesting that World Health Organization states that 61% of diseases that affect humans, what I think my good friend Joyce talked about, zoonotic diseases, actually come from animals. So 61% of diseases are coming from animals, but they've gone further and qualify and say that 70% of emerging and re-emerging diseases are actually coming from animals, and the interaction between animals and humans is then in an environmental context or in nature. So when you look at things like Ebola, there are stories around where Ebola came from. When you look at COVID, there are stories around where COVID is coming from. I think those who are tracking international press talked, there's a new influenza virus, swine influenza virus, which then is something that we then need to be looking at and keeping an eye on even as we look at COVID. So there's actually an interaction between animals and especially food animals, the nature or the environment, and the relationships to public health. I think also important is to allude to the fact that even as we look at the Kenyan context, where we are beginning to push ourselves into land pressure issues, we have 47 new counties. Each of those counties is trying to build a new headquarters, which means we are either destroying agricultural land or we are moving slowly into natural resources, the environment around which is becoming critical. And you can see the cases around Long Forest, the water towers in Mau, and those are things that we need to look at. As that interaction keeps going on, then we are having interactions between animals from that natural setting with humans, and then possibilities of then having outbreaks of diseases, and as we alluded to, zoonotic diseases, which then has an impact on public health. But I also don't just want to look at it from a public health disease perspective per se, but also look at other things that are happening in nature that then have an impact on public health as we go along. One of the most easy one to look at is the interaction between harvested crops. When we have maize or grain and how we are interacting with that grain, and these countries are countries where we know maize is very critical. We're now seeing outbreaks of aflatoxinosis in dogs. Is it because we failed to manage the grain aspects? Is it because we have pushed ourselves into a place where grain is becoming an issue and it's part of our food system, both at animal levels and at human levels? And part of then that interaction is what then are we feeding our animals on? And those who've lost dogs would know what we are looking at. But is it only a dog issue? Is there an interaction beyond dogs with the grain? And so one of the things then we need to look at in terms of managing some of these things is the freedoms and how we manage animals in those ecosystems. When we are moving animals, when we are getting into natural habitats, because we are creating new cities or development is pushing us into natural habitats of animals. How do we manage that situation so that the animals are still catered for, and whatever the animals are does not get into public health, become a public health concern? When you're building railways through national parks, when you're trying to enclose natural parks into certain settings so that animals are then restricted, what is the likelihood of disease and public health consequences of some of these things? I think those are some of the debates that we need to be looking at. And later on, as we go through the discussion, Joyce has alluded to some of those things around fundamental freedoms that animals need to be catered for. How do we ensure that animals are fed and fed well? When you interfere with the habitat of the animal, how do we ensure that that interaction, the animal is able to access good quality water and good quality food without then causing a situation that becomes negative, impacts negatively on public health? And when you're looking at things around that, we're looking at also things around the comfort of that animal, freedom from discomfort, the environment the animal is in. If the animal is in negatively impacted environments, do we then have disease occurring? In situations like when we have drought or we have rain, severe rains, do we see conditions like Rift Valley fever getting out of hand? And how do we then manage that ecosystem by using the early warning systems to ensure that disease and public health doesn't get into that kind of processes? And how, when we are looking at that situation, how do we ensure that the animal, which in some cases could be a cow that is our only source of livelihood and food, is not becoming a risk to human populations around it. Same occurs when you're looking at managing disease. How do we ensure that the population, whether it's natural, the wildlife in its natural setting, or whether it is animals that are interacting with the wildlife, that disease doesn't cross over in some of these things. I think that to me is what we need to be looking at going forward as a country, especially when you look at a growing population that is putting such great demands on the natural resource that we have. And remember that the Constitution also gives us certain responsibility about managing that natural resources with a view of protecting animals, especially livestock and wildlife. If you look at your fourth schedule, it's clearly elaborated around that. And how then does that connect to public health? That is something that we need to look at. I'd like to leave it at that point and be open to questions so that then we have a more interactive discussion than me sounding like the guy who knows it. Over back to you.
Thank you so much, Dr. Victor. That was surely an illuminating discussion. We're looking forward to still sharing with you during the Q&A session. You have highlighted a very important aspect of the food system, which is how human beings interact with nature and interact with food and the kind of impact it will have on their health. Yes, I do remember that connection about that link to the COVID, the appearance or the outbreak of COVID-19 that was made to that wet market in Wuhan, where we had animals like bats, salamanders, lizards, and crocodiles and others on sale. And there's that allusion to the, let me term it, the free consumption of wildlife products that is also being pointed to as one of the possible causes of COVID-19. However, as you correctly put it, the jury is still out on that one because the scientists have not finished their investigations so that they can give us the exact cause of the disease. But it would be in our best interest, as you rightly put it, for us to be careful on the way we handle the animals in the environment, even as we raise them for food. And to also remember that the end product, the end product for the food system should be to ensure that our health is maintained and is actually boosted by this food that we take in the form of animal products. Now, questions to Dr. Victor and Dr. Joyce can also be put here on the chat. You can send them here on the chat and we will be able to forward them to the panelists for answers during the Q&A session. Now, next up is Dr. Mushibi, who will now be making his presentation. Dr. Mushibi, I hope you are around and ready for this one.
I'm here. Thanks.
Thank you so much. Chukua usukani.
Now, good afternoon, ladies and gentlemen. I was approached and asked to make a little presentation on the effects of antimicrobial growth promoters on public health. I hope I'm audible.
Yes, I can hear you. I hope everyone else can hear you as well.
Okay, so it's about the effect of antimicrobial growth promoters on public health. Now, before getting into the growth promoters, I would like to mention something small about the populations. I think over the last 5 or so decades, we've had rapid growth in our populations. Today, I hear we are over 50 million. During the same period, we have had urbanization, a rapid movement of populations from the rural areas into the cities. With that movement into the cities, we have had an increase in demand for food. Now, this led to intensive production systems and I will specifically talk about poultry and pigs. So these were intensified in order to produce enough food for these big populations that are now in our cities. Having said that, now I want to define antimicrobial growth promoters, which basically are any medicines that destroy for the bactericidal ones or inhibit growth of bacteria. And these medicines are administered in very, very low subtherapeutic doses. Now, the reason these growth promoters were administered in the first place was to try and eliminate the microorganisms in the gut of poultry or pigs. You will remember that the main function of the gut is digestion, with the ultimate aim of absorption of all the nutrients in there to enhance performance and growth of the birds or the pigs. So the presence of any bacteria, viruses, and other parasites would compromise the integrity and the health of the gut. This therefore would put pressure on the entire gut, with a net effect of a reduction of the intestinal functions, the major of which is absorption of nutrients, which results in growth. So feed millers decided that it was a good thing to introduce antimicrobial growth promoters in feeds to try and keep in check the populations of bacteria and all these other bugs in the intestines of the animals, so that they can at least have improved performance of the animals. So the promoters were meant to control diseases by destroying or inhibiting the growth of the bacteria and improve on feed conversions, thereby promoting growth of the birds or the pigs. Now, it is said that good gut health is the best growth promoter. When you succeed in making the gut very healthy, then there you have a good promoter. So towards the end of the last century, people started realizing the dangers of using antimicrobial growth promoters. Certain countries started banning their usage, and one of the first countries to ban the usage of antimicrobial gut promoters was Sweden. Later on, I think in 2006, the European Union banned the use of antimicrobial growth promoters in animal feeds. The main dangers of the growth promoters is that because of constant exposure of the bugs in the intestines of animals to subtherapeutic levels of antimicrobials is resistance. And this resistance is not the resistance of the drug to the bugs, but it's the resistance of the bugs to the drugs. Some of the drugs that were being used as growth promoters were being used in treating human beings. And so you can see the link between the antimicrobial resistance as a result of eating foods that have residues of antimicrobials that were used in those foods. It is estimated that by the year 2050, we'll be having more people will be dying of antimicrobial resistance than cancer. In fact, the data is that we shall be losing about 10 million people by 2050 to AMR, more than cancer does. Today, I'm told the people dying due to antimicrobial resistance is about 700,000. So it has been important to make sure that we manage gut health in a different way. And thank God, today we have different products that are being used to try and manage the health of the gut. A lot of them are organic acids, which have now come in and replaced the initial antimicrobial growth promoters. They are probiotics, prebiotics, enzymes, among others, that are now being adopted strongly in enhancing the health of the gut and avoiding the antimicrobials completely. In the early times, drugs such as chloramphenicals were also being used. And as you would recall, chloramphenicol was a drug of choice in treating typhoid fever, what we call typhoid. So keeping off these drugs from the food chain is beneficial, not just to us as the population, but also the companies that develop these molecules, because they pump in lots of resources in coming up with a given molecule, and if the product is not used properly, then resistance sets in and they are not able to recoup their investments. So we also get the antimicrobial resistance issues today mainly from the drugs that we are using to treat the birds and the pigs and all these other animals, because most of the drugs, some of them are excreted through the metabolites are gotten rid of through the produce, the milk, the eggs, the meat. So constant eating of these with subnormal doses of antimicrobials impacts negatively on the effect of that product in controlling the pathogens in a human situation. So I think we should be able to discuss a little more during the discussion time. And I hope that lays sufficient ground for us to start the discussions. Thank you very much.
Thank you so much. Thank you. Hello. Thank you so much, Dr. Mushibi. Your presentation reminded me of a documentary I once watched on Al Jazeera about the misuse of this antibiotic called, I think it's called ivermectin, that was being used in chicken. And the same chicken then ends up on the fish and chips plate of the consumer in Nairobi. And once this individual then falls sick, you can imagine what effect ivermectin would have on him or her if it was prescribed by the doctor. Having taken note of the fact that this person has been indirectly consuming this drug through the chicken that he or she has been eating for all that other time, while thinking that they were taking food. So your presentation is quite thought-provoking, and I'm hoping, kindly mute your mics, kindly. Your presentation is quite thought-provoking, and I'm hoping that there will be vigorous discussion around it during the Q&A session. Now, we are moving on to the next presentation by Dr. Maurice Karani. Dr. Karani, can you hear me?
Yes, I can.
Okay, this would be your time. Please proceed, kind sir.
Okay, thank you very much, everyone, for having me in this important discussion. So I'll be talking about the role of One Health and how we can be able to avert future pandemics. And it's quite telling we're having this discussion about this a major pandemic, a COVID-19 pandemic, that possibly, as others have alluded to, broke out from a wet market far away in China, when everyone in this sense of the word wasn't aware. And as we talk, there have been like up to 2 million cases, 500,000 confirmed deaths, and untold devastation of the global economy. Now, to untrained eye, this pandemic would look like it's unprecedented, like it's novel, but scientists have predicted such scenarios in the past. And this is because a perfect storm has been brewing for some time in the last decade. And this is largely due to the fact that the world is more interconnected than before. That is humans, animals, and the environment. The interaction is becoming quite intense. In the past, you have had things like Ebola, HIV/AIDS, H1N1, H1N5, and Zika. Apart from all those disease outbreaks starting from different parts of the world, they have a similar outlook. They're all coming from animals. They are zoonotic, diseases that can be transmitted from animals to humans. Again, this is because of the intense interaction that has been happening between humans, animals, and the environment, and this the One Health. Because this is a problem, the interaction, because population is increasing. In the past century, 100 years, we have had 4-fold increase in human population. It's predicted in 2050, there will be 2 billion extra people. So if you think about it, that means more proteins. So there will be increased demand for animal protein. That's beef, poultry, fish, and wildlife. There will be, and these again will link to intense and unsustainable farming, intense poultry farming, intense pig farming. There will be increased use and exploitation of wildlife because of the protein, because of the taste, and also this will be compounded by climate crisis. And this means that this COVID-19 will not be the last pandemic visiting upon us, because it's like the world is becoming like a crucible for disease transmission and emergence. So it's important to know that this will not be the last pandemic, but what we can do is that the solution here lies in the problem. The problem is the intense interaction, and I propose that the solution be the One Health. The human health, veterinary health, and environment coming together and working to predict the future epidemics, to stop if we can, if we cannot, to mitigate the impact. Clearly, the current pandemic has shown that probably we are ill-equipped to stop those pandemics. So to do this, we need to have hotspots and it has been, we have already hotspots, Africa, Asia, South America. Those are the possible hotspots for emergence of disease. Again, research has shown that up to 60% of emerging diseases are zoonotic in nature, and out of the 70% of the 60% are diseases coming from wildlife. So we can see wildlife is our next hotspot, and we need to have surveillance in such places to know what's happening. We need the scientists to act as detective work, like the CIA of the world, to go ahead of the curve and look at what's happening before it happens. We need to go to those ecosystems, the pristine environment, check what's happening, look at how the viruses and bacteria are behaving before there's a spillover of those assortment and reassortment of the genetics to human. So that's what I propose. And before even I finish, I want to say that what we're having now, the pandemic, the big pandemic that's affecting everyone, it may sound, again, it's not novel, but every year the world loses up to 2 million people due to neglected tropical diseases. Other zoonotic diseases that doesn't affect everyone, but disproportionately affect the poor in the low and middle income countries. Think about it, 2 million people lose their lives annually due to those diseases. We need to think keenly about these diseases because they affect humans and they affect animals. And the problem is that maybe COVID-19 has touched everyone's imagination because it's affecting everyone without minding the socioeconomic aspect of the people being affected. The neglected tropical diseases mostly affect the poor. So I propose that research will help us get ahead of the game and help predict, lessen the impact of the global diseases which are leading to loss of life and shutdowns. So I want to stop there. I've given a platform of what I think is happening, and hopefully this can be able to elicit discussion around what we can do, scientists, as people. In Kenya, One Health has taken shape. There are structures in place, they need to be strengthened. But what is missing mainly is that what is working is probably between human and animal health. For example, in 2018, this kind of multisectoral transdisciplinary work helped predict and mitigate the impact of Rift Valley fever, and that was very good. But what is missing is the environmental impact, the environmental part, to help cement efficient working of One Health. Thank you.
Thank you so much, Dr. Karani. That was insightful and very, very relevant, considering the times that we are in today. You have said that, I particularly like what you said about getting ahead of the curve. That means that in order for us to achieve the goal of One Health, and we need to have teamwork, serious teamwork between all the various sectors around health, around environment, around food production, so that in the end we'll be able to identify some of these hotspots and the viruses and the bacteria that are likely to prove a threat to human health, and then streamline these efforts to mitigate the outbreaks of disease if and when they do come. Wonderful indeed. We are so grateful. Once again, I would like to remind all the participants that you can send your questions through the chat at the bottom of the screen to the various panelists, address them to the various panelists, presenters who made presentations here, and we will be able to address them in the Q&A section. At this point, I'd like to thank you all for attending. The numbers are really good. We were expecting quite a small number, but the response has been overwhelming so far, and we are indeed pleased and privileged by the attendance of each and every one of you. Now, having gone through the presentations, I think that was the final one. So at this point here, maybe we would like to go into the Q&A session, where the panelists can now field questions from the participants. So we'll be looking at the questions as you ask them. And remember, we'll also be we'll be looking at how relevant the questions are, as well as following that old rule, that tried and tested rule of first come, first served. So bear with us as we look at the questions, and then the panelists will be able to answer them as we go along. Dr.
Well, Agre,
yes?
Agre, the first question that I see, and it's at what point does the discussion on human-wildlife conflict matters engage the veterinarian? And secondly, with efforts to reclaim land, forest land currently high on the agenda, is the wildlife corridor being considered? I don't know who this question will be thrown to. Victor, do you want to dare?
I will try. I think the question of engaging veterinarians in human-wildlife conflict is something that the vets are the best place to answer. We have vets working in wildlife. We have vets with expertise and experience in human-wildlife situations. I think it's for us to then make ourselves relevant to the felt needs of the society. I think the days when we sat somewhere and waited to be called upon to offer expertise or skills in managing some of these things are long gone. It's for us to create a niche, so to speak, in some of these things. We have a whole wildlife veterinary services department at KWS. That's part of it. We, as KVA, now have a wildlife branch, and I think that's part of what they came together for, to address some of these things that are coming out and emerging and are critical for the survival of the profession, but also for the survival of the country at large. That would be my comment on that specific one.
Right. Second question, and I think this one is, if I wouldn't be amiss if I throw it to Mushibi. So where are we as a country on the usage of subtherapeutic doses of antimicrobials in poultry and pigs, considering that there's over-the-counter sale of therapeutic products in Kenya? There's minimal control of aggregate activities in the country. Maybe just a comment as you answer the first part of that question.
Thank you, Derek. Now, it is common knowledge that the management of over-the-counter drugs in our entire region is a disaster. I think the closest neighbor that I know that has something that is resembling proper management of over-the-counter drugs is South Africa. Ideally, a farmer should not walk into a drugstore and walk away with a prescription-only medicine. Any medicine on whose label there is inscription of the words POM should not be in the hands of a farmer. Unfortunately, in our entire region, all these countries neighboring Kenya, you walk into a shop as a farmer and buy the product and go with it. And that is where the misuse starts. It is a very, very hard task that calls for a regulator that has capacity, because the only way that you will manage that is making sure that, first of all, the agrovets are properly licensed and the agrovets are owned by people that are technical and are available all the time, because we have cases where these agrovets are owned by technical people, but they are never there. The people left there are not technical at all. So it is a tough balance. It's a very, very tough balance. And I know that where I sit in the pharmaceutical side of things, we are part of the people to blame, because we pump out these products into the agrovets. Because remember, the multinationals want to sell, and then the agrovet fellows also want to sell. So the regulator has a huge task, and that's why it is very, very good that now, as vets in Kenya, we have a regulator of veterinary drugs who will dedicate all their efforts and resources to managing the usage of drugs. It is in this vein that I have been very, very vocal myself as a person about the management of veterinary drugs and the regulator, who in our case is the Veterinary Medicines Directorate. These directorates need to be allowed to populate, to have inspectors who I believe will be vets, posted to all the counties when they will have enough money to do that, so that we start with those small baby steps. But I know it's a huge task, but it is doable because it has been done elsewhere. Thank you.
Thank you, Dr. Mushibi. I know that one you're passionate about, especially considering you're involved with the VMD. There's a question for Dr. Thaya. This is from Lillian Ooko, and her concerns are on transmission of the disease when handling animal products such as meat, eggs, fish. Is there a way a product can be used on the food items to be kept? Sorry, hang on, that disappeared somewhere. To keep them safe from the virus. She said, I think that's COVID, based on COVID.
Hello?
Yes, Joyce, you can go ahead.
Yes, Lillian, I hear your question, and it's a good question. The transmission of the disease when handling animal products. Current research does not show that the disease, that is the COVID-19, is transmitted through the products. However, just like any service that the virus can land on and may be transmitted through contact, through the touch, there is maybe a possibility of that egg being handled maybe by somebody who has the virus. So then the important thing is hygienic practices. Hygiene, wash your hands, wash the products before handling, do not mix raw and cooked foods. But so far research has not shown that it is being transmitted through products. And a product being used to keep the product safe, that product is water and good hygiene. My submission, thank you.
Right. Next question. I think this is for Karani, Morris. If you can see, there's need to look closely at the environment. Most diseases enumerated by you, including HIV and AIDS, are due to environmental factors, including industrialization, emissions, etc. So he'd like a comment from you on that basis.
Yes, it did. Thank you for the question. It has been shown there is benefit in tackling diseases holistically, not only looking at the pathogen, for example, because there is the environmental factor, and for most of the disease, another important factor to look at is the social drivers of disease. Most of the disease may be, like for example, COVID, there is of course the pathogen, the virus, but of course failure to wear a mask, going to crowded place would drive the disease. So apart from looking at the pathogens which are zoonotic or not, they are the social drivers for those diseases. And therefore there is benefit in the look at the environment and indeed holistically. Over. Hello.
Go ahead, Morris.
Yeah, I think I finished. I was saying that there's a benefit at looking at the disease holistically, not only at the pathogen, for example, because the social drivers of disease also play a big role in propagating the disease spread. Yes, over.
Victor, I'm just looking at one question that is a follow-up to your answer, and somebody has cheekily asked, and this is basically, I think, where there's human-wildlife conflict. Basically, what is the veterinarian's input in terms of advising policymakers on population growth? As in, should we just allow humans to populate themselves at the expense of animals?
Interesting question, Derek. My thought process has always been that we need to be part and parcel of the problems that are around us. And I think it's not a question of humans taking precedent over animals. It's a question of then asking ourselves what works. And I think somebody talked about sustainability. And if you go down the road of the sustainable development goals, the SDGs, then there are things about sustainable cities, sustainable ecosystems, sustainable farming systems, water systems, etc., etc. I think the challenge we've had as vets is we've restricted ourselves to matters relating to treatments. And this is something I've said for a very long time. We need to broaden our scope and start saying, what is our role in human-wildlife conflicts, for instance? What is our role as veterinarians in Urbanization, which is the next big thing. We have a big population. We are trying to convert every available space into urban cities. Look at what is happening in our 47 counties. Each county is trying to build a county headquarters. Is it necessary? And if it's necessary, where does that leave us in terms of sustainability? So if the county is next to a wildlife ecosystem, how does that relate to the wildlife ecosystem? I think one of the most interesting things I've seen since COVID happened is wildlife is beginning to reclaim spaces. Yesterday, I think on one of the news channels, there was a bear that was walking in people's backyards, simply because now we've been locked down and animals are slowly reclaiming what rightfully belonged to them. So the question we need to ask ourselves is in our development, and I think it goes back to, in the Kenyan context, the constitution. We have a constitution that talks about a land use policy. Where is that land use policy and what does it say about some of these things? It's not just about wildlife, it's also about when you're converting arable land into concrete jungles. What exactly are we saying? Are we saying food will come from elsewhere, now that we're talking about food systems? Are we saying that since and the last time I tried doing a survey in Kiambu, I was quickly told by what used to be poultry farmers that they find it more sensible to build a flat than to keep chicken anymore. The question then for us in food systems is how then are we going to be able to ensure that the population that is growing rapidly in this country, 1 million people every year, is catered for? And sometimes then I have that debate of, are we as Kenyans justified to complain that food is coming from Uganda, eggs is coming from Uganda, when our producers are saying the system is just not working? So it's a more complex issue than just sitting down and saying, this is what the vet is going to do in human-wildlife conflict. Where there's human-wildlife conflict, there's other conflicts that we need to be looking at. And how then do we contextualize that in the light of what constitutional requirements, laws that are in place, and as a profession, what is our advice on some of these things? I think that's what we need to be looking at. Thank you.
Well, thank you very much. Now, Joyce, is the One Health policy that was drafted, has it been implemented?
Yes, the One Health, we have the zoonotic disease unit as a response to One Health, and it has been implemented. Like I think somebody said, the involvement of the whole sector, both wildlife and environment, may not be very strong, but yes, it is implemented. And like you remember, during the Rift Valley fever outbreak, the unit and the One Health approach really did work. So yes, it is implemented. It needs a lot of strengthening though, but it is implemented. Thank you. Derek, over to you.
Yes, I was just scanning through the questions, and they seem to be to all be sort of tackled, but perhaps Mumanyi, if you can, I think enlighten some of the press members of the press. I think there are some of the members of the press in here.
Derek.
Sorry.
Derek.
There
Yes.
is a question.
Can you hear me?
Somebody speaking very quietly.
There is a question relating to there is a question relating to COVID and the slaughterhouses.
Okay, Joyce, if you can go ahead and answer it, because I am barely able to get you. I don't know why.
I don't know why you can't
there you
hear
go.
me.
There you go. You can go. Go ahead.
Thank you. There is a question in relation to COVID-19 spread. The situation on the ground within the local slaughterhouses is one thing. Social distancing is a big challenge. This is true, and not just in local slaughterhouses. In many markets, including meat markets, social distancing is an issue. But then I would encourage the animal health specialist within and around the slaughter facilities to impress on the people the importance of this, because in every sector, the guidelines that have been given by the Ministry of Health need to be followed by everybody. We know there are many, many people in the slaughterhouses, so the social distancing may be a challenge, but it is on us to prevail upon the people there, working closely with the Ministry of Health to ensure that the guidelines are followed. Thank you.
I also see a question here from Paul Mbogwa, where he says that there is a current trend on the rise with the middle class keeping pets such as dogs and cats and ornamental birds. Most of them have little knowledge on how they should be handled, fed, and treated. As Dr. Joyce alluded, hygiene and even social distance is essential between humans and animals to prevent spread of zoonotic diseases and even COVID. I haven't seen any advice or warning from the government or other organizations on such. Is there a reason to worry? I think, Dr. Daya, that should fall on your plate.
Thank you. And it also falls on anybody dealing with animals, the animal welfare issues. The spread of diseases is important, zoonotic diseases. I don't know what Paul means advice. So maybe you may need to, but there is need to if the social distancing has been talked about, maybe not between human and animals, but social distancing in respect to COVID currently, and it should be for all zoonotic diseases. But of course, there is need to increase this by government to all consumers and the whole public. So I agree, there is need to increase that information sharing. Thank you.
Okay, so there is need actually for increased awareness to be created and more messages to be disseminated on keeping animals or keeping pets safely within the home to reduce the risk of zoonotic diseases. Dr. I'll get back to you.
Agree.
Yeah.
If I could just prod Emily, what is your opinion on that question? Because that's quite an important question. You can see I'm obviously trying to avoid it.
As for, I know when this COVID outbreak began, we had a meeting with Joan Magero and some of the animal welfare teams and Dr. Cheriot, and they are aware about the COVID-19 and dogs and cats. So now, if you have noticed in the newspapers at least, and on websites, there have been people coming out about the measures and what to do. But Dr. Cheriot had asked us to be careful about even newspapers putting out those stories, because we had panic in countries like Egypt and South Africa, and things were going a bit wrong and they had to counter a check. So now that is on the awareness. I know right now, presently, KEMRI have put a study, and they're looking for funds where they're gonna do tests between humans and people with and without COVID, and also testing those ones who have pets to test their pets. They're gonna go around doing pets. So now that's something that's actually happening and going around. As when it comes to teaching people about proper animal welfare, yes, there is a very large need, and there's always been a need. And I think as veterinarians, we need to see how we can work with the media and school curricula to see how these can be developed. I know some of these programs along the aspect had already been working and they would have progressed this year, but unfortunately because of COVID, and I know many people, even Cascava, have had chances where they go to the community. So it's just to see how we can sit down and further these inputs. For the wild birds, as I know that's a very big issue, but I think we need to see how we can work with Cascava and perhaps do maybe pamphlets and give to owners, because it's a very small certain community that keeps these animals. So a more centralized approach in messaging them may work better than trying to do it in a broad manner. I think I'll just stop there because we can continue forever on this point. I hope that helps.
Maurice, there's a question regarding One Health for you. How can we leverage on the high public awareness on zoonosis as a result, of course, of COVID to expand the One Health agenda?
Yes, I totally agree that we currently can confidently say that we have momentum. The public appreciate or have got knowledge on the causes of disease. They know what is zoonotic disease. And the government also is paying attention or keen attention to One Health working. A few weeks ago, the Director of Medical Services was tweeting about the need to embrace One Health working. And he did some of the veterinary organizations helping in testing for for COVID-19. So I think what we can do is just to take this moment to push our agenda, the One Health agenda in the country, and I'm sure there will be much better reception to really ensure One Health space expanded in the country and indeed mainstreamed to ensure that now we can make it the way of life to handle medical problems, to handle disease outbreaks, for example. So yes, it's a good opportunity to work in the One Health space. Over.
There is a question here for Dr. Mushibi on the Q&A, where by Elvis Madara, where he thanks the good doctor for the excellent presentation and then asks the following, asks thus, how much effort is the pharmaceutical industry putting on the ground to enlighten the farmers as the end users of their products on good animal husbandry practices, since this is the most appropriate way to reduce antimicrobial resistance through, or consumption or use through disease prevention and control? Dr. Mushibi, I don't know if that one will be too much of a mouthful for you.
No, it's not. Thank you, Elvis. A good question. And clearly it touches the heart of the problem that we have with farmers using products. Using of some of these products is not in itself a problem. The main problem that is there, and we also see it in human, is once farmers buy these drugs, they do not use them correctly. They never get the correct advice on the dosage, how they should measure the drugs, and then they also have no idea about how long they need to use these products. For chicken, for example, I know there are farmers who are advised in some of the agrovets to medicate the morning water, and then after the birds finish that water, you don't need to put the drug, you wait for tomorrow. So those birds clearly are exposed to subnormal levels, low doses of these therapeutic agents, and then ultimately this leads to resistance. Pharmaceutical companies have an obligation to ensure that their products are used properly. It is in their own interest that the products are used properly so that resistance does not set in quickly. If, as pharmaceutical companies, we do not do that, then our product, the shelf life of our products will be very, very short, because sooner or later there will be resistance and no one will want to touch the product. A perfect example for this is the acaricides. We all know what happens to acaricides. So all pharmaceutical companies are supposed to conduct regular training of farmers on the usage of their products. They are also supposed to train them on the withdrawal times. How long should it take the farmer who's laying chicken have been on some antibiotics before they can sell these eggs? But then again, there is a problem with I guess is the level of our level, how rich our farmers are. I once attended to a farmer who had 8,000 laying chicken. And we put them on an antibiotic, and I told her that she needs to dispose of the eggs, to throw them away for the period of treatment and for a few more days after treatment. 8,000 laying hens would be having close to 7,500 eggs a day. Treatment is 5 days. So I was telling this farmer that they need to be throwing away around 40,000 eggs. And she looked at me and told me flat on my face that she will not throw away a single egg. She will take the eggs to the market. So we have a little balance here to do between observing of withdrawal times. A lot of our farmers inject animals that are milking, and they milk at the end of the day, and they still sell that milk or consume that milk. But it is important that we still educate them so that even as they do so, they know that they are doing the wrong things. They are exposing not just their neighbors that they're selling the milk to, but ultimately that pathogen will cross over the fence and get to themselves in their own homesteads. So yes, we need to do a lot of extension work to try and educate the farmers on the usage of the products. I think the main challenge has been that getting to all the farmers, it would not be an easy thing, and it would be expensive. And I think I would want to touch a little on a related question asked by Dr. Ngeiwa about extension work and the county system. I observe like this slowly a disconnect between the structure from the DVS, the county directors of veterinary services. I see like that link has kind of been disconnected. And the county directors are more responsible to their bosses in the counties than to the DVS. A big number of the counties don't even allocate sufficient resources to agriculture. Yet agriculture is huge in this country. So they don't have extension workers, and it is the lack of extension workers on the ground that sends these farmers to the agrovets to go and get those drugs for themselves. So again, for pharmaceutical companies, we also need to train the people selling the drugs so that they have the correct knowledge which they can then pass on to the farmers. Thank you very much.
Thank you. Back to you, Dr. Derek.
Thank you, I agree. I'm trying to scan through the questions, and I think most of the questions have been looked into. Unless somebody's got a burning question, I can't see anything that's been left out. Because I've got questions about COVID in China, which I think probably this is not the forum to look into that. Unless somebody else has got a comment, I'd give it back to Kevin to
Derek,
finish.
I want to make a comment.
Yes.
With your permission.
That's all right.
Now, I think other than the pharmaceutical industry and the farmers out there, I think it is the responsibility of each and every veterinarian to safeguard and protect the usage of antimicrobial agents. Some of us have gone out there and have come across cases where fellow colleagues have been. And when you listen to the advice that the farmers are given, you feel like this vet probably needed to be updated a bit. And so I also think it is the duty of the pharmaceutical companies to engage all professionals, especially in the CPDs, so that they bring out details of their products to these colleagues, because they are part of the stakeholders that use these products out there in the marketplace. When as a vet, I use a product, I am sure about my diagnosis, and I use a product and it does not work, I should be the first one to know that this product has not worked. We have cases because remember, as a profession, we are a reflection of our society. Our professional norms will revolve around our societal norms. And I think ours for a long time has been a man-eat-man society. Even some of these issues we are talking about encroaching on wildlife land, a lot of it is not about a population explosion. It's about greed, where someone who has tracts of land elsewhere comes and grabs some other piece here because they want to put up some structures there and build. So if you buy a product and you find this product does not work, you buy it the first time, the second time, the third time, then you should not buy it a fourth time, because it will, what makes you think it will work this time when it didn't work the other time? So our market has become a dumping ground for veterinary products. We have a lot of rubbish products in the market, and it is my prayer that the regulators, all of them, including the feed industry that is regulating themselves because they don't have anyone regulating them, will pay a little bit more attention to the usage of products and how the products perform, and naturally kill the products that don't work. I'm yet to hear of a small animal practitioner who goes and buys vaccines that have been kept on a shelf. No small animal practitioner will buy a parvo vaccine that someone is keeping on a shelf, because the instructions are that that vaccine must be stored under refrigeration. So my plea to all of us is, let's, as much as possible, if we have to use antimicrobials, use them properly. But above all, we should practice prevention, usage of vaccines to prevent disease, and only use antimicrobials when the control mechanism breaks down and the disease sets in, then you have to treat. But we should not inject every animal that comes in front of us and charge some money. Thank you.
Thank you so much, Dr. Mumani, for that powerful addition there. I believe now it should be time for us to go into the media session. There being no other pressing.
Agree.
Yes.
There's a, I think there's a post-panel discussion poll that Kevin wants to run.
Okay. So we should now allocate time for it.
Well, it only take 5 minutes, so you can continue with the rest as the poll is running, I think.
All right. So would it be, would you suggest that we go ahead with the
Yes, just go ahead. Yes.
Okay. We would like, thank you so much, Dr. Derek. At this point, we would like to open the floor for questions from members of the press who are in the session with us today, in the webinar with us today. You can unmute your mic and ask your question. First, introduce yourself and the media house you work for, and then ask your question. And kindly direct it to the particular member of the panel that you wish to address the question. Thank you.
Hello. Hi,
Go
my
ahead,
name is
Paul.
Paul. Yeah, my name is Paul Thiongo from the Standard KTN Farmers TV. Now, thank you so much. That was an excellent presentation. My question actually, I think, goes to everyone or all the panelists. How now does the farmer know? Because if they're relying on advice from the extension officers and the veterinaries in their locations. And how now can they be certain that the kind of advice they're being given is correct? And is it an ethical issue on the side of the veterinary to administer or inject drugs to animals just to make some money? Or now how now do you regulate this kind of issues where now you're dealing with AMR?
Do I take that or I wait for other questions?
Go ahead, Mushibi.
Now the question is, how does a farmer out there know that the advice they're being given is correct?
Yes.
And is it unethical for a professional to be administering drugs for money, for the sake of it? Now, the first part of the question is, it is expected, it is required that all the agrovets selling drugs have trained animal health practitioners, at least one person in the agrovet knowledgeable in matters animal health. And so when this farmer walks in, they should give the correct advice. But what seems to happen on the ground is that there are people who think that it is expensive to employ even a certificate holder in animal health and have them on their counter to help these farmers who walk in with problems. The challenge we face, I think, is on the regulatory front. Our regulator is still young and does not have enough human resource to be out there, to be policing, because our people are used to someone looking around, looking after you so that you do the correct thing. But then even as a farmer, Paul, if you walked in and you are talking to someone, you are presenting your case, you will be able to tell someone who is not sure of what they are telling you. And I've seen many farmers who have said, I went to such and such a place and what they told me, it didn't look like this person was sure about what they were telling me. So we need to be educating our farmers that if you find that someone is not helping you, or they have sold you a product, you've used, it has not worked, then you probably need to seek second opinion. So it is again education. We need to educate the farmers. On the aspect of unethical behavior by professionals, I think this is there. It is all over the place. I know of weird things that people do out here in the name of getting some money. But again, this is an area that is regulated by the Kenya Veterinary Board. And I am also aware that I think the board is not able to be everywhere. They can't be everywhere to know everybody that is doing the wrong things. But we need to educate the farmers that if they learn that someone was doing something unethical, then they need to report to the board. Because I know that all the complaints that have been reported to the board have been acted upon. Thank you.
Thank you for that.
Perhaps, Mushibi, if I could just add a little bit on, because there's a little part of the last part of Paul's question about paying for the sake of it. I think, Paul, you in the media perhaps should also try and help pass a message from the profession, is that the public should not expect that a service will be delivered by a animal health professional without any compensation in terms of payment. That should be thrown out of the window. Animal health specialists or animal health practitioners have spent a lot of time and money to get themselves to the position they're in, and the public is duly expected to remunerate them accordingly. But what you should actually be basing your question is that are they getting value for money? The public should then learn to get value for money, but at the same time, expecting that they will not be charged for services rendered should be an idea that should be discarded and thrown away with the key swallowed somewhere. That's my take on that.
Can I quickly add something on that again, Derek? Kindly.
Go ahead.
I think in addition to that, some farmers would want to pay very little fees for services rendered. And in the process of looking for the cheap practitioners, they end up in the hands of quacks. And our profession is infested with lots of quacks waiting for this farmer who wants cheap service. And they will readily offer the service. These are the fellows, some of the fellows who will inject water and charge, and the farmer pays because the guy is cheap. But at the end of the day, they do not benefit. So yes, as Derek has said, the farmers must be aware that there is a cost to it. They will have to pay for the service. Thanks.
To add on to that with a question, just to get to know exactly what the farmer should expect. Is there, how can the farmer now recognize between a quack and a professional? Is there any documentation that the profession should, or the veterinary should present to the farmer, or how now, does the farmer know exactly that they are getting value for money?
Can I answer that?
I think, yes, you can answer that, and we can probably have Victor chip in as well, having been in the board before.
Maybe Victor can answer it then.
Okay, thank you.
I thought anybody could answer that question. Paul, the hard reality is that every registered veterinarian has a registration card that comes from the Kenya Veterinary Board that shows his registration number and its valid period. All of us must be retained in a register, and the register is closed by the end of March and is actually gazetted. Or if it's not gazetted, a notice saying where it can be found can be is available. For now, I am sure that if you went to the Kenya Veterinary Board website, you'll be able to get a register of all veterinary surgeons in this country, a register of all veterinary technicians in this country, and a register of all veterinary technologists in this country. Anybody missing out on that document or register is not validly registered and is not allowed to practice. It is that simple. But I think beyond that, farmers should also have, I think one of the things I wanted to say, Paul, is that farmers should also create a rapport with their animal health service provider. I think the biggest challenge we have is a lot of us farmers, and I'm talking from a farming perspective, go to a vet when the animal is sick. I think farmers should start looking at things of working with a vet throughout the lifetime of the animal. What I would prefer to call preventive medicine, which this country doesn't do very well. We look at curative medicine, but we ignore preventive medicine, which would save us a lot of money and would save farmer a lot of grief. Because by the time you're treating a sick animal, the animal is not making money, it's not generating good produce, and you're not having a very good product. So farmers should also start going back to saying, can I have a veterinarian who I refer to, who will look at the whole system? You look at the feeding habits, you look at the environment, the housing that the animal is in, you look at hygiene and sanitation, we do the vaccination, so that you then don't have a problem with disease, which is the tail end of the process. And I think that is something that even our very own colleagues, my very own colleagues, is something we are encouraging them. We're saying it is time for us to go back to hard health and not to be waiting in our shops or in our clinics for a sick animal to turn up. We need to work with the farming community and work with them to ensure that we deliver a service. And that's part of the veterinary extension that I think is lacking and needs to be looking at. Now, Derek, I wanted and requested that I be also allowed to talk about something that a former director of veterinary services, Dr. Ngiwa, has raised.
I agree. I was about to ask you about that. I've seen it.
So about veterinary service, and Mushibi was right. there's a disconnect between the DVS or the National Veterinary Service, as we want to call it, and the county veterinary services. And part of it is that disconnect is causing us a lot of grief. And I think part of the challenge we are having is that even the constitutional provisions that we were given are not readily available or has not been developed to where it needs to be. I know we talked about, if you look at the Constitution, the part 4, section 4 that talks about the roles of national government versus the roles of county governments. Extension, which is one of the things that Dr. Ngewa is asking about, is part of what national county governments should be looking at. And if you look at part 2 of section schedule 4, it talks about agriculture, including crop and animal husbandry. It talks about county veterinary services, county health services, in particular veterinary services, excluding the regulation of the profession. Those are things that we need to drive and ensure that they are available. And maybe Paul and the Fourth Estate can help us driving some of these things. I think for far too long, what we've done as a country is to concentrate on curative medicine. And that's why we have at certain levels raised the medics to another level. But you're forgetting that you will never have a healthy population unless you have look at the curative aspects of medicine, or the preventive, you look at preventive aspects of medical services. You look at the meat that comes to my table, is it wholesome? Is it good quality meat? You look at the production system, the information going through to our farmers. Is it ending up with a good, wholesome product? Because what we eat is what we are. If you're eating maize with mycotoxins or milk with mycotoxins, then we end up with a problem that then it becomes very expensive trying to treat. Maybe what we need is to take a step back and strengthen the county animal husbandry services, county veterinary extension services, so that we have production that is wholesome, which then doesn't give us problem with human related issues. The second bit of it is, if you look at under national government, we are supposed to have developed a veterinary policy, which is have addressed all the issues that Dr. Ngewa is asking, the connection between county and national. I know at some point, and I think at during the tenure of Dr. Ngewa, we developed guidelines for delivery of veterinary services, which was signed by county governments and was supposed to develop a reporting channel where the county governments would then link to national government. That didn't work because that piece of the guidelines were good piece of legislation, but they were not, didn't have the backing of law. We need to ask and demand as veterinarians that the veterinary policy be ratified. It is 10 years since the constitution was ratified. We are still not having a veterinary policy. It still gets to Kilimo at a certain point and disappears there. We need to have a veterinary policy that then explicitly addresses issues around delivery of veterinary services, the connection between county governments and the county veterinary services and national veterinary services, and then gives everybody a role to play. Otherwise, at this point in time, we are up in the air because there is no guidance. The only piece of work that was done, which was the guidelines, doesn't seem to have taken, is not being taken seriously at certain levels because it's a guideline. It has no backing of the law. The law asks for that. In conclusion, I also want to say that if you look at the same national government, the role of national government, Article 22 or Bulletin 22 talks about protection of the environment and natural resources with a view of establishing a durable and sustainable system of development, including, in particular, Part A, fishing, hunting and gathering, and Part B, protection of animals and wildlife. Constitution already says that we need to have sustainability. The crafters of the Constitution were way ahead of us in some of these things. Unless we look at using the environment and natural resources in a sustainable system of development, and in particular relating to fishing, hunting, gathering, and protection of animals and wildlife, we will end up in challenges. And those are the challenges we are grappling with because we have not driven the process of getting the constitutional requirements in place. We are now talking about BBI and adjusting the Constitution. Yet the basics of the Constitution that would help Mwanjiko are not even in place. And at certain times, I think that the politicians are hoodwinking us, and we need to start asking ourselves, why would we put some of these provisions in the Constitution and then not have them addressed and effectively catered for? I rest my case.
Thank you so much, Dr. Yamo. At this point, I just have to refer to a document that I once read, which was the Food and Agriculture Organization and the United Nations report on food security in 2010, which defined sustainable diets as diets with low environmental impacts, which contribute to food and nutrition security and to healthy life for present and future generations. And the FAO goes ahead to say that sustainable diets are protective and respectful of biodiversity and ecosystems, culturally acceptable, accessible, economically fair and affordable, nutritionally adequate, safe and healthy, while optimizing natural and human resources. Listening to your very powerful comments, I couldn't help but go back to this particular part of the document and see what the gaps are in our country right now. Yes, indeed, I agree with you that we need that veterinary policy in place. Dr. Derek?
Well, I think that's about it. Unless there's any other person from the fourth estate who would like to have another bite at the cherry.
Derek.
Yes. Okay, Joyce.
Hello, you hear me?
Yes, you muted yourself.
Yes, I noted that it was a mistake. Now, I want to continue on where Dr. Yamo has left on the question that had been asked by my former director. The issue of the county and national veterinary services. In as much as the policy is not yet gazetted, currently there are two pieces of legislation that are being developed, which have taken into consideration the role of the county and the national veterinary services. That is the Animal Health Bill and also the Veterinary Public Health Bill. These two have been discussed. They have been subjected to the stakeholder, the wider stakeholder, including the counties. There has been a lot of debate between the county governments, particularly the CECs responsible for animal health, and discussions are still going on, but they have been discussed and they are progressing. And the roles of both the National Veterinary Service and the county veterinary services have been considered and they have been put in place. So we believe that when these bills are put in place, because some of the issues that Dr. Yamo is talking about that have been put in the guidelines will actually be put in law. So it will be easy to carry them out. And this includes extension, not directly, but information sharing, because extension as per the Constitution is a devolved function. But the issue of the role of the CDVSs, the role of the National Veterinary Service, they have been well put out in these two pieces of legal instruments. And we believe that when they come to, when they are enforced and when they start being implemented, some of these things will be taken care of, and the disconnect will, to a large extent, be removed, because the mechanism of communication between the National Veterinary Services and the county veterinary services have been put in these pieces of legal instrument. My submission. Thank you.
Thank you, Joyce. Yes.
I would like to just throw a spanner in the works, then I will leave.
Okay, go ahead.
And my spanner, which maybe Joyce can enlighten us on, is the Constitution is also very interesting how it deals with veterinary services. And I think that's been part of our big challenge as veterinarians. If you look at Schedule 4 that talks about the separation of duties and responsibilities between national and county government, Part 2, which then gives responsibilities of the county government. The second bullet, the second input is under county veterinary services. If you read county veterinary services in particular, then it says A, B, C, D. E says includes veterinary services. So the question I keep grappling with, which I hope these two pieces of legislation that Joyce is talking about will sort, is whether veterinary services is part of county health services or veterinary services still remains where we traditionally knew it, which is in Ministry of Agriculture, Livestock and Fisheries. I think that's the biggest disconnect that we need to deal with, because constitutionally, veterinary services at the county level is part of county health services. It is not part of agriculture and livestock as we know it. I rest my case.
Thank you, Victor. That is a spanner that I'm not able to really answer. But the two pieces of legal instruments are looking at the role as given now in the constitution of the national government. That is mainly capacity building, the issue of standards and quality assurance of service delivery. So the main role of the national government would be particularly in those two areas. And considering that any treaty, international treaty that has been signed by Kenya becomes part of the law, and we know the issue of communication as far as the OIE, so that has been taken into consideration. But as to where veterinary services is placed, I also am like you, I do not know. Currently, it is still in all counties that I know of at the agriculture departments, as is also with the national government. It is still at the agriculture sector, but I don't know, nobody has pushed to what you are saying, but that is what the constitution says. I don't know what will happen when somebody wants to push it that way. My submission.
All right, I just want to mention that the poll, I'm just about to close the poll that's been running. So if you please fill it in, I'll be closing it in another 1.5 minutes. Over to you, Kevin and Agre.
Just before as we wait for the results of the poll, there's a comment here from Christopher. I think it's a general comment where he says, most county public service boards have forgotten the role of county veterinary services. And so they have limited human resource to do extension work and even carry out disease surveillance and vaccination in their regions. Most cattle dips and tick control measures that were being carried out by the community with the help of the veterinarian are dead. Now, I do hope that once the gray areas between who does what are sorted out in the two pieces of legislation that Dr. Thaya was talking about, once that legislation comes into effect, we do hope that some of these gaps that are being highlighted, especially in the counties, the ones that are to do with disease surveillance, vaccination, and so on, will be handled, and we will not have issues of outbreaks and many other problems that bedevil the livestock sector because of that particular confusion. Now, I don't know, Dr. Derek, whether at this point it would be in order for us to ask the panelists to make their closing remarks and maybe limit each of them to 2 minutes, just to say something that they think, not something that was left out, but something that they think we should carry home with us as participants. So
I'm under the guidance of Kevin. That's fine with me.
All right. So at this point, I think we would let us give the floor to Dr. Karani to make your closing remarks. What do you think we should walk away from this place with? Would you kindly shed some light on the most important thing that you think we should take away from this webinar today, in your view?
Thank you very much. I think, thank you for having me in this discussion. And I think for the participants, the thinking to really put emphasis on is the One Health working. One Health, that is the human, the animal, veterinary, and environmental. In Kenya, animal and human health structures are fairly good, just need to be strengthened. But what I want everyone to think about is how we can have an environmental sector being mainstreamed in the One Health working. As for now, of course, when you talk of ZDU, mostly you're talking about animal and human health. So we need to think about environment. 2, setting up surveillance systems. Again, as I had said earlier, Africa is a hotspot for emergence of novel pathogens. So we need state cutting edge technologies, biosurveillance, doing, for example, metagenomics, going to hotspots in forests, for example, bat caves, and starting to survey, to look what's happening in the viral world, so that we can be ahead of the curve pertaining reassortment of pathogens. And this, I think, will be very helpful in surveillance. Thank you.
Thank you so much, Thank you so much, Dr. Karani. So we need to step up surveillance systems by making use of cutting-edge technologies, because, as you said, Africa is a hotspot for emerging diseases. So we need to be ahead of the curve and on point with whatever is going on in the animal world, so that we can spot these emerging diseases and work quickly to mitigate their effects. Dr. Dhaya, what would be your takeaway for us this evening?
My takeaway would be 1, the responsibility for your own health. We are talking of public health, rests on you. It rests on me. Responsibility of food safety rests on the food business operator. The responsibility of animal health rests with the animal owner. So in as the providers would overlap this, but the key responsibility rests with each and every one of us, just like we have the responsibility of keeping safe from all. Let us all make sure friends, let us engage the service providers, let us report abuse of the responsibility that people have been given. And if each of us plays their role, then I believe that we can be able to move public health a notch higher. Thank you, and God bless.
Thank you so much, and may God bless you too, Dr. Dhaya. You've spoken it as it is, that indeed the responsibility for our health, for public health, rests on us. Responsibility of food safety rests on the operators of those establishments that sell these food products to people. Responsibility for animal health rests on those that own the animals, and we are all required to be proactive and engage service providers and make sure that we report abuse of responsibility whenever we spot it. So we should be each other's keepers. Thank you so much. Dr. Mushidi, what would you have for us as we wrap up this evening's proceedings?
Thank you. If there are any 3 big names that have been repeated a lot of times in the year 2020, one of them is COVID-19. The second one is mental health. And the other one is antimicrobial resistance. Now, I want to close with the antimicrobial resistance. We do not have to use antimicrobials if we practice good animal husbandry. If we prevent infections. This we can do by, first of all, ensuring that we use the resources that we have for vaccinations, where vaccines exist. For preventive measures like spraying cattle, advising farmers to spray or to wash their dogs so that then they don't get sick and require these antimicrobials. And where we have to use antimicrobials, let's use them judiciously, in the knowledge that someone has invested so much money to come up with that product. And therefore, its usage, its proper usage would enhance its lifetime and would enable these developer to recoup their investments. Above all, let us remember that nutrition is the best medicine at all times. The animal eats well, the animal is healthy, the immunity is strong, the animal is healthy. So my parting shot is nutrition is the best medicine and not that antibiotic. Thank you.
Thank you so much, Dr. Mushibi, for that takeaway there, where you've said that we don't have to use antimicrobials all the time, and if we have to use them, let's do it judiciously and wisely. And as well, let us also remember that nutrition is the best medicine as it keeps animals healthy. And also to also remember that every time we are using antimicrobials, proper usage of these antimicrobials ensures that their lives, it actually extends their lifetime and helps the developers to recoup their investments. Dr. Yamo, I know you are
Thank you, Agri.
Yes.
Mine will be very brief. I think
you can still throw another spanner. You have a few minutes. You have a minute or two.
No, I will not throw any more spanners because I want to be part of the solution, not part of the problem. I think it's been a very interesting discussion around the importance of food systems in public health, and people this year have learned a great deal about food systems and where we need to be looking at, what we need to be looking at, especially in reference to COVID. I want to go back and piggyback on what Emory said about One Health and the need to then cater for that One Health. But I want to stay on the animal bits of it and say that a happy animal, a well-treated animal, when we cater for all the 5 fundamental freedoms for the animal, ensuring it has good food, good clean water, it has a good environment which is safe and comfortable with good ventilation. It has been catered for in terms of disease, and disease is managed using good hygiene and good vaccination, as Mushibi has alluded to. And we're allowing that animal an opportunity to express its natural behavior in the setting that we put it. And there's no condition that is causing it stress or fear. Then we have an animal that will produce optimally, but will also produce good quality products. And in a nutshell, what I'm saying as my parting shot is a happy animal produces better, which ensures that we have good food security. It produces more, which ensures that the livelihood of the farmer is catered for. It produces good quality products, which means part of the food safety is catered for. And so that's what we need to strive for in anything that we do, that ensure that animals are well catered for in the production systems that we are having around us, and not taking shortcuts. And then we'll have Ritua Mushibi left. We will not use antibiotics in our production system, and we'll be able to have wholesome products that are getting onto a table without any issues from the animals that we're dealing with. Asante sana.
Thank you so much, panelists. Maybe this one would just be thrown as a random question to all the panelists, just as we wrap up. How much is being done currently by the veterinarians in the country in terms of research into zoonotic diseases? I know that currently we are hearing of whatever is going on at Cambridge with regard to the COVID-19 vaccine, HIV, TB, malaria, and these other diseases that affect human beings. I've not heard much from the distinguished veterinarians of this country on what kind of research is being done into zoonotic diseases and how we can probably stop or control the spread of these diseases into the population around here. Would anyone care to bring us up to speed with that as we wrap up? Dr. Karani, maybe if you can help us on that one. Is there research that is currently ongoing on zoonotic diseases by the veterinarians in the country? And are there prospects for findings that will help us in our efforts to control these diseases?
Yes, there are various initiatives on zoonotic diseases, indeed. But what's missing, for example, is mainly studies, like to come up with new vaccines that would be able to prevent those diseases. And this is mainly because of changing what I would say funding priorities, and that's maybe in another webinar, maybe that would be something to talk about. How do we mainstream our priority areas? Because most of those zoonotic diseases are neglected in said area. So the funding is not as much because our priorities are really controlled by the funding bodies. And that does not sit properly with our local priorities. And that's a problem. That's I would say that's a challenge in the research world of zoonotic diseases, most of which are neglected. Over.
Thank you so much, Dr. Karani. So you have mentioned there that there's a funding challenge and there's need to mainstream funding of research into zoonotic diseases by our veterinarians, among other professionals, as part of the effort to mitigate the effects of outbreaks of zoonotic diseases. Dr. Derek, I believe at this point you will have something to say.
I will leave it to Dr. Bogonko as well as Kevin to have the final say.
Well, as Dr. Kelvin is preparing his remarks, I want to thank each and everyone that has made time to attend the webinar. Kindly, we know that we have made your email addresses available. For those who would like a copy of the presentation, they can get in touch with the organizers for a copy of the same. And as we are also waiting for the poll results that Dr. Derek was carrying out as we continued with our deliberations. So Dr. Mumanyi, what do you have for us?
So at this stage, I will welcome our Kenya Veterinary Association, Nairobi branch chair, that is Dr. Bogonko, to give us a vote of thanks and close the session. Thank you.
Thank you, Dr. Mumanyi, for you have to risk his life if he wants to eat well. But luckily, he has reliable neighbors.
Someone needs to mute their mic. Currently, please mute your mics if you're not presenting. Or if you're presenting and there's something making some sound in the background, like a TV or any other electronic device, kindly also mute that one as well.
Oh, thank you, Bwanagri, for that. I think now the disruption is over. The background voice is also gone. I would like to thank everyone for jeez. Now, am I audible? I keep getting muted. I don't know what's happening.
Proceed.
Please
Okay.
proceed. Please proceed.
Okay then. Now I would first of all like to thank the KVA Nairobi branch, the branch executive committee for this wonderful and first time webinar. Also, I would like to thank Bwanagri. Thank you for finding time to come and join us and do this wonderful and noble course. Dr. Chibeu and the entire Kiskava, thank you also for partnering with us and offering us the platform to air this webinar. To our panelists, panelists. Much grateful. Just thanks, and more of the thanks for the wonderful piece of sessions we've had across board from all the panelists and the attendees also for finding it good enough to join us and attend the webinar. Nothing much from my side, but a lot of thanks and urging people to continuously practice the social distancing, the staying safe and everything during these tough times. I think from my side, Dr. Momanyi, I'm done.
Thank you so much, Chair, and thank you, everyone. You are now free to exit and have a blessed evening and blessed week ahead. We've left a link in the chat box whereby you'll access the full report from this particular webinar. So have a good day and bye-bye from us.
Thank you so much.